Today, we're going to explore a huge shift in how we think about health. Seriously, it's a shift that takes us way beyond the doctor's office and right into the very fabric of our daily lives. Welcome to our explainer on population health.
So let's just start with a really big question. What actually makes a person, or even a whole community, healthy? Now, if you immediately thought of things like hospitals, prescriptions, or your annual checkup, hey, you're not alone. But what if I told you that's only a tiny piece of a much, much larger puzzle? You see, the core idea we're digging into today is this move away from a reactive model. Treating an illness after it's already shown up. The new view? It's all about being proactive. It's about building a foundation of wellness from the ground up, right where we live and work every single day.
And this isn't some brand new idea. Way back in the 19th century, the British Prime Minister Benjamin Disraeli said this. He recognized that a healthy population is the very bedrock of a successful society. It's the engine for literally everything else.
Here's a great way to think about it. We're shifting our role from being firefighters to being architects. For decades, our healthcare system has basically acted like a fire department, rushing in to put out the flames of disease once they've already started. But the new goal is to be architects, to design communities and systems that are kind of fireproof, where health and well-being are built right into the structure of society itself.
Okay, so this brings us to the main event, population health. The easiest way to wrap your head around it is to imagine we're just expanding our lens. We're zooming out from focusing on the health of one single patient to seeing the much bigger picture of what makes entire groups of people healthy or unhealthy. And when we say population, it's easy to think we mean, everyone in a country. But it's actually much more specific. A population could be the residents of a single neighborhood, all the employees of one company, or even all patients who share a diagnosis, like diabetes.
So here's the official definition. Population health really looks at two things: the overall health of one of those groups, and, this part is absolutely crucial, how health is distributed within that group. This is how we shine a light on where the gaps and the inequities really are.
All right, so if traditional medicine isn't the only thing driving our health, then what is? Let's get into the 5 keys that truly shape the health of a population. These are what's known as the social determinants of health.
To put it simply, these are the conditions in the places where people are born, where they live, learn, work, play, and grow old. These are the powerful forces that have a massive impact on our health and our quality of life long before we ever even think about stepping into a clinic.
And check this out. This framework from the U.S. government's Healthy People Initiative shows it perfectly. You can see how all these different factors, our environment, our behaviors, our access to services, they all interact to create our health outcomes. So let's break down the 5 main categories.
First up, economic stability. This is all about having a steady enough income to afford the absolute necessities for a healthy life. We're talking about things like nutritious food, safe housing, and of course, medical care.
And the scale of this problem is huge. About 1 in 10 people in the United States lives in poverty. That kind of constant economic stress, well, it just puts up massive barriers to living a healthy life.
The second key is education. Access to quality education is directly linked to better health. It's not just that it leads to better jobs and more income, it also gives people the skills and the knowledge to navigate the healthcare system and make healthier choices for their entire lives.
Number 3 is one you probably saw coming: healthcare access and quality. Because even when we focus on prevention, having access to really good care when you need it is still absolutely critical. This covers everything from preventive screenings to treatment for chronic diseases. And here again, access is a major challenge. Around 1 in 10 people in the U.S. don't have health insurance, which often prevents them from getting care until a small, manageable problem becomes a full-blown crisis.
Okay, let's move to our 4th key, your neighborhood and built environment. Think about where you live for a second. Is there clean air and water? Are there safe parks to walk in? Can you easily get to a store with healthy food? All of these physical things in our environment play a huge, huge role in our daily health.
And finally, our 5th key is the social and community context. This one's all about our relationships and our support systems. Having positive connections with family, friends, and your community can actually protect you from stress. On the flip side, things like discrimination and isolation can be seriously damaging to your health.
Okay, so we get what influences population health. But how do experts actually measure all this stuff? How do they spot the patterns of disease in a group? Well, it really comes down to 2 very important ideas.
This bathtub analogy is probably the best way to get it.
So picture a bathtub. Incidence is like the new water flowing into the tub from the faucet. It measures the number of new cases of a disease over a period of time. Now, prevalence is the total amount of water in the tub at one specific moment. That's the total number of people, new and old cases, who have the disease right now.
Let's make this super concrete with an example. Imagine a nursing home. If 5 residents get a new COVID-19 infection this week, that's the incidence. But if, on Friday, you count up every single resident who is currently sick, that total number is the prevalence. See? Both numbers tell you something different, but equally important about that population's health. So we've zoomed out from the individual all the way to the population, and we've looked at the big social factors that really shape our lives. What's the big takeaway here? Well, it all points to a shared responsibility.
This journey we just took is really the crucial point. We start with that traditional view of a single patient in a doctor's office. Then we zoom out to see the whole population. And finally, we understand how that population's health is shaped by all those social determinants around them.
And really, if you remember just one thing, it should be this. Creating a healthier society isn't just the job of doctors and nurses. No way. It's a task for city planners, for educators, for employers, for all of us. Health is created in our schools, our workplaces, and our neighborhoods.
So let's end with this thought. If our health is truly a reflection of the communities that we build, then the question isn't just what can a doctor do for us, but what can we, all of us, build together to create a healthier future for everyone.